All right, good evening, ladies and gentlemen. We are welcome to this event, the Maiden Edition of Health for a New Nigeria series, which is a series initiated by Doctors For Peter Obi. This is the Maiden Edition. We apologize for starting 10 minutes later than scheduled. All right. So far, we have 13 participants online, and we hope to hit our maximum. I would like to let us know that we are streaming this series via our social media platforms, Twitter, YouTube, Facebook, and Telegram. All right, so in case maybe people have difficulty joining, they can always join via these other platforms. All right, so before we start, I would like to invite Dr. Shegu Ebitami to quickly introduce this series. I wouldn't want him to go deep talking about Doctors For Peter Obi until we have more viewers online. Then when he's done introducing the series, I will go ahead and read the citation of the speaker before we continue with the series. Dr. Shegu, please just introduce the series. Let us know what this series is about and what informed this series. You can just briefly introduce Doctors For Peter Obi, and then we can now go ahead to the meat of the day, which is to discuss healthcare and good governance, then using Peter Obi and Anambra State as case studies. So, Dr. Shegu, please go ahead. You have the floor.
Good afternoon, everybody. It's my deep pleasure being here. The journey to a new Nigeria, the Doctors For Peter Obi experience started in June 11, when a group of us felt that this country cannot continue the way it's going, because we are on the definite path to destruction. Since then, the group has grown to 7,613 doctors at the last count. I'm sure it's a lot more than that now. We had an ABC, which was A, activate your PVC, B, be aggressive in getting other doctors on to the movement, and C, coordinate medical outreach. On the medical outreach, we've done about 48 so far. And almost everywhere we talk about our outreaches, what we get hit with is, what did Peter Obi himself do when he was governor? We decided that that is a record that needs to be straightened. And at first, we did a book launch, and we are following that up with this series. The Health for a New Nigeria series is a series where topical issues in the healthcare industry, like health and good governance, like brain drain, like intersectoral rivalry, health finance, and the likes, will be interrogated using seasoned professionals. It is a Doctors For Peter Obi philosophy that is because the collective intelligence of Nigerians has not been accessed. That is why the country is still in doldrums. So we will make a concerted effort to bring people of deep knowledge, people who understand the sector, both as practitioners and as researchers, to provide innovative, out-of-the-box solutions to the problems confounding the healthcare industry in Nigeria. We expect that by the end of this series, we'll be able to provide a compendium of practical, locally developed, proven policies that His Excellency Peter Obi can start with and hit the ground running in revolutionizing the healthcare industry in Nigeria. We enjoin everybody to stay at attention. We know that there are people who are of a different political standing here because this series is broadcasted, is streamed on many media. We expect that at any point in time, over 5,000 people will be listening in across all our platforms. We enjoin you to keep an open mind. This series is not just about the man, Peter Obi, it's also about the country, Nigeria. Let's rebuild this country so that our children will have a place to stay. I'm thrilled by the facilitator today. I'm thrilled that he accepted to take this and to bring expose into what Peter Obi did as governor, as the governor of Anambra State. Once again, thank you, everybody. Let's have a wonderful deliberation. Thank you.
Thank you very much, Dr. Shegu Ebitami, the National Coordinator for Doctors for Peter Obi. Without wasting much time, I think we need to enter into this presentation. I would like to invite Dr. Vincent Ubochi to make his presentation. But before he does that, I would like to tell us a little bit about who Dr. Vincent Ubochi is.
Citation of Dr. Vincent Nwokejezi Ubochi. Dr. Vincent Nwokejezi Ubochi was born in 1968 to Nze and Mrs. T. Ubochi Iweala of the Onyeka clan in Umuwiso Kindred, Obiato village of Amuriomanze, Isu local government of Imo State, Nigeria. He attended community primary school, Amuriomanze, and comprehensive secondary school, Amuriomanze. He later proceeded to Federal School of Arts and Sciences, Saba, where he obtained higher school certificate in sciences, and later to the University of Jos, Nigeria, where he studied medicine and surgery. He did his housemanship in Murtala Mohammed Specialist Hospital, Kano, and then National Youth Service Corps at Oni Memorial Children's Hospital, Ibadan, in Oyo State with an award, and later worked at Jordan Medical Center, opposite Kakanfo Inn, Mobile Bus Stop, Ibadan. He returned to the East, where he did his residency training in psychiatry at Federal Neuropsychiatric Hospital, Enugu. He was appointed a consultant psychiatrist in the hospital and then rose to the rank of chief consultant, psychiatric special grade. He also studied statistics at Federal School of Statistics, Tinker's Corner, Enugu. He is currently the head clinical services at Federal Neuropsychiatric Hospital, Enugu. He has held several positions of honor, both academic, community, and religious fora. For example, he is the chairman of Amuriomanze Development Union, Enugu branch, was president Amuriomanze Academic Circle, was the former chairman of Thinkers Corner Joint Neighborhood Association, Enugu, was a former member of Omnium Sanctorum Catholic Parish Council, and one-time president of Association of Resident Doctors and chief resident doctor, Federal Neuropsychiatric Hospital, Enugu. He was member of and vice chairman of various committees of Nigerian Medical Association, Enugu State. His hobbies are music, farming. His philosophy is, life will teach everybody, and while you hope for the best, you prepare for the worst. He is married with 5 beautiful children.
Ladies and gentlemen, I present to you Dr. Vincent Nwokejezi Ubochi. Please, sir, go ahead with your presentation.
Yeah, good evening, everybody. Wherever you are, you're welcome to the show. and the discussion we have today. I must acknowledge the fact that this is a very serious matter, especially this time that Nigeria needs a strong rebirth, and the movement thereof is a very important one that all and sundry need to get involved. Let Nigeria get better. It has not been very easy for us here. I thank the organizers for calling on me to talk on this all-important forum of Health for New Nigeria, organized by Doctors For Peter Obi. I've been following the activities and I've been involved in the activities as much as I can and in my little way. And I find it a very noble cause to join and to be part of. By the end of this discussion, we would have been able to understand what is this almighty health that doctors always talk about, and the healthcare system or the healthcare where we work. What are the relationships and understanding of what good governance is? And how is good governance related to health and achieving healthy nation? Then I will now go into the main topic, Peter Obi's healthcare program in Anambra State. How he did it, what he did very, very well, what he did not do very well, and what he needs to improve on further as if he gets the position to be the president of Nigeria. So having gone through what he did in Anambra State and how he did it, I will be able also to identify the gaps, like I said before, and then how suggest ways to close this gap, especially not in Anambra State now, but in Nigeria, as the health situation in Nigeria is. In the middle, there are lots and lots of evidence to show what Peter Obi did. So I will take a moment to show a clip, a sort of slide of all the numerous achievements Peter Obi did in Anambra State, because if I take it along with this discussion as it is, it will give us a very long slide, and some people may be bored about it. Then at the end of the day, I will conclude and then expect some questions, if any, and to create forum for discussion further. Health is defined as a state of well-being, physical, mental, and social well-being, and not merely the absence of disease or infirmity. That means that there are very, very important components of health. One is physical. When we have malaria, we have surgery, we are admitted in the hospital for one reason or the other that borders on our physical health, accidents, trauma, or any of such things. Another one is mental. That's the psychological. That borders on how we interpret our world, how we see things around us, how relationships with other people are being interpreted and internalized by us. Is there anything abnormal about it? Or is it the best way it should be? Then social, that's gamut of issues. Poverty, poor nutrition, relationship problems, and whatnot. All these are embodiments of health. So one can only be said to be healthy only when you apparently will be able to achieve some level of normalcy in this domain defined as health. I have my reason for bringing up this, emphasizing on the importance of this health and the components of health, because every aspect of our life revolves around this. That brings health to be the cornerstone for the comprehensive development and well-being of people, and the hallmark of national prosperity and social progress. There will never be any national prosperity and social progress if health is being played down on. Health also remains the center of sustainable development goals, as well as the precondition, outcome, and indicator of progress. What this has emphasized is that health is the epicenter of all our existence and must be taken as seriously and very seriously as possible. Any government that decides otherwise is not helping the development of the country. Healthcare, anything we do to prevent diseases or illnesses of any type, diagnose them, treat them, and also rehabilitate situations when it has gone too wrong, that a lot of complications are involved. Any system, any method, any approach we use in this is a healthcare system, whether traditional, formal, or non-formal. But what is important is that health should be delivered by accredited health professionals, because that is when we can say, yes, we are getting it right. And that is why everybody in the health sector, every professional in the health sector has a regulatory body to ensure that quality manpower, trained and certified, retrained and further recertified, are involved in healthcare management in Nigeria. Now, governance is a manner of governing a state or country like Nigeria. The exercise of authority or power in order to manage a country's economy, political, and administrative affairs. This emphasis is very, very important, because we entrust people that should be very, very sensitive to the activities and the benefit of their people. In terms of economic planning and distribution, political gaming, and also administrative affairs of the whole nation. This is very, very important, because when we get it wrong at this level, every other things will be affected seriously. Governance is also seen as a power relationship, sometimes formal or informal process of formulating policies and allocating resources, process of decision making, and mechanism of holding government accountable. This threw us into two prongs. What are we doing as citizens? And what are the government doing? Is what the government doing what we want? for our progress? Or is it not what we expect them to do? If the reverse is the case, that they are doing what we don't expect them to do, how do we hold them accountable? That is the point. So governance now involves both the citizens and those that make decisions for the citizens. And all of us are involved. And that's why in this discussion, I find it very interesting, because we are discussing issues on how we should take our destiny in our hands, speak among the best from all the contending political jobbers, and then pick the best. And good enough, the Doctors for Peter Obi has engaged themselves in this, and that is very, very important. Now, health and governance, how are they related? Health requires good governance to flourish. Very, very, very important. Without good governance, health cannot flourish. And health is determined by multiple factors outside the direct control of health sector. For example, education, economy or income of the individual living condition, decision made by other sectors, and government policies and implementation. Just look at it this way, that the doctor will be in the clinic attending to a patient, and kidnappers will come there to pick him up. That patient will not be attended to, and the doctor is not even safe himself. The implication of this is that there is strong relationship between security and health system delivery, care delivery in every clime. Let's look at it also, that a surgeon is in the theater performing a complex surgery using NEPA. Suddenly, NEPA takes lights. The outcome of health care in this situation will definitely be jeopardized. So, any person that needs to be in the situation here to manage the economy of the country, take decisions bothering them, must be sound, selfless, empathic, and not only that, in fact, must be at the high level of compassion. That is, the person must be compassionate. Compassion is the key. Because when we are compassionate, we will not steal public money. When we are compassionate, we will not tamper. We will deliver the message to our people and be proud of it. So the realization of health is therefore the fundamental human right that everybody must take charge. It is our right to demand for good health and good healthcare system. We should hold anybody accountable if that is not being done. It's unfortunate that doctors are usually at the receiving end, because while we are in the clinics and some of these errors takes place, they will tell the doctors today, the almighty Medical and Dental Council, the government will be exonerated for not providing adequate facility, for not creating enabling environments for you to deliver your services, for not giving you enough opportunity to be yourself and to practice. While in the clinic, are your children being taken care of wherever they are, whether in school? Do you have enough money and sound mind to pay their school fees without getting bothered? All these things are the issue that borders on governance. And we want people to look at it before they select anybody. Now, that now takes me to the proposition of the leadership we need in our government. The person must be able to create structure and processes that ensures accountability, transparency, responsiveness, rule of law, equity and inclusiveness, empowerment, and broad-based participation on the health of the citizens. This leader must be able to create a deliberate connect between health and the numerous sectors of government in policies and implementation. When I mean the leader must, I'm not referring to the bodies around him like the ministers, the special advisors, and all the rest of them. But it has to be an inborn characteristics of the individual who takes this position to really weigh himself. Can I impeach well on the goodness and health delivery of our citizens? This try to create the relationship of health sector, that's health and development, with other areas, sectors of Nigerian governance. You see, poverty eradication poverty has a lot to do with health sector and health care. How does it do that? All payment in Nigeria is through out-of-pocket expenses. How many people can afford this? What has happened to the health insurance scheme? Why can't the formal and non-formal health insurance system rule the day? Those that are making decisions in other sectors, for instance, roads transport minister, how effective is the road? If there's an accident, how fast can an ambulance or individuals push this person to the hospital? Because early caring for a patient has a lot to do with the outcome at the end of the day. Government policies and implementations, environmental sustainability, education, gender equality, and women empowerment, and name it all the components of Millennium Development Goal, and also reviewed in the Sustainable Development Goal. Very, very important. So, when we talk about the man Peter Obi, who is trending everywhere in Nigeria today, and I was given this topic to look at, I tried to extract what is the philosophy of this man. I read a lot about him. I've listened a lot in some of his talks. I took a tour to Anambra State to get some of the information and documents I'm presenting here today live and verifiable. I also contacted the medical stakeholders, including the NMA, the head director of hospital services, the commissioners, some of them within the period Peter Obi ruled, and putting things together. I came out to understand that the man, Peter Obi, has clear understanding that there is a relationship between poverty, education, environmental factors, as well as women empowerment, policies and implementation, and health. That stands him out. And this was captured succinctly in his programs, the budgetary programs in Anambra State, where he adopted Millennium Development Goal as a guide to development of the almighty Anambra Integrated Development Strategy. I'm talking about the Millennium Development Goal, which ended in 2015, because that was what was obtainable. That was the guide to development. But currently now, we are dealing with Sustainable Development Goal. But based on the Millennium Development Goal, he was able to develop Anambra Integrated Development Strategy, ANIS. How did he and his team come up with this? They first of all did a poverty mapping of Anambra State. They contacted each individual communities and community heads and firsthand identify problem. That means they were very, very meticulous in conducting need assessments. It is not a matter of building gigantic hospital that cannot be used, but he developed the hospital based on need. And his developmental program all revolves around health, such as eradication of extreme poverty and hunger. That was one of the major ANID principles. He believed that if people are removed from poverty, they will be able to solve their need and think ahead. Their health care will be taken care of because they'll be able to afford superior health management. Gender equality and women empowerment. He used to say it that there's a saying that if you empower a woman, you have empowered a nation. Reduction in child mortality and also maternal health still all revolves around women. Give them what they need, they will be able to deliver what you want. There's this saying, you give them, they multiply and give it back to you. So that's why women are important in community development and everything about our life. Part of the earnings is combat HIV and HIV/AIDS, malaria, and other diseases, environmental sustainability, and global partnership in development. This is captured in his budget plans. Among them include rehabilitation and the equipment of more general hospitals in Enugu State, Anambra State, the partnership with more private and mission-owned hospitals to deliver the healthcare we deserve, increasing the declining size in the health workforce in the state, and improving the facilities and infrastructures of various cottage hospitals and primary healthcare centers. He also increased programs, activities geared towards controlling HIV and other communicable diseases. Now, in this instance, he formed his budget line in this area. First instance, rehabilitation of the hospitals. There will be a pictorial slide that will give us all these achievements. Partnership with private hospitals and mission-owned hospitals. There will be a lot of pictorial guide that will give us this. Increasing the size of health workers in Enugu, Anambra State. How did he do this? He discovered that there is a lot of gap in health worker need. Doctors, nurses, pharmacists, and pharmacy technicians, lab science and lab science technicians, that's the community health workers, and all the people that are needed. What he did was, there is need for manpower development. Then he invested heavily in Anambra State Specialist Teaching Hospital, so-called Ojukwu University Teaching Hospital, where he started from the beginning, from the scratch to the end, and developed the school, the hospital. There is a slide that will give you all the structures, ranging from theater, gates, roads. Name them, every component of the hospital, all newly built. And he ensured the accreditation of this school for medical student training, as well as training of specialists. This will boost the manpower need by the states and Nigeria at large. Then the partnership with mission hospitals, because it was found out that mission hospitals forms the most trusted, compared with the government hospital, by the citizens in receiving their health care need. So he decided to upgrade them. There is a slide that will show this. He did all things in these directions. He also partnered with a World Bank and other development partners in their assisted programs and projects. And in each of them, he made sure that the states provided their counterpart funding. Sometimes some states will not continue to fund because what your assistant partners will give you is contingent upon what you are able to bring. And he completed it and achieved a lot of feats in this direction. He has strategic partnership with private health sector for expanded coverage in health subsectors. Partnership for enhanced engagement in research and health programs. He partnered with National Institute of Health, also providing his counterpart funding in some of these. Before I go on, I would like to play some of the slides or some of the things I've just said. Now, let's look at these slides briefly. What I said before is the construction of structures and facilities at Chukwuemeka Odumegwu University Teaching Hospital, Oka. This is the gates of the University Teaching Hospital. This is College of Medicine building, positioning this for training. This is a panoramic view of part of the teaching hospital building. You can see also specialist clinic, obstetric theater, community medicine consultant clinic, radiology building constructed. Also, some of the building. In fact, I want us to see that in this laboratory building, back approach of the university, outpatient department, specialist clinic, obstetric theater building, modern kitchen, ultra-modern theaters, the gangways, the drug distribution facilities. In fact, he was able to build 2 pharmaceutical stores, specialist wards, children's ward, female ward, general wards, pediatric wards, chest clinic, the consulting clinic, accident and emergency. Every embodiment of that is needed in teaching hospital. House of staff quarters, we are all there, outpatient departments, and you can see them, all of them, well developed. This will give you the rundown of all the things he did in the teaching hospital. Then, He shifted from there to secondary health care facilities. In the secondary health care facilities, he was able to renovate as much general hospitals as possible. At General Hospital in General Hospital on Onitsha, he built and equipped a cardiac and a dialysis center in the hospital, completely equipped. He was also able to build cottage hospital at Umunze in Anambra State, male and female wards at the Kulo of the General Hospital, doctors' quarters at General Hospital on Onitsha. We built Anyamele General Hospitals and many other health institutions he rehabilitated, which are so many to be shown. Now, these are some of the general hospital facilities he provided. This is Umunze, the General Hospital. The General Hospital, like I mentioned before. New block of the building there. New doctors' quarters at the General Hospital. Anyamele General Hospital, Anaku. Now, he also embarked on primary health care. That means he was able to get a connect between the primary health care system, the secondary health care system, and the tertiary health care in healthcare system delivery. He acknowledged that, and he did a lot about that. You can see the Mibo primary health care. This is primary health care repeated. Also, within the primary health care level, he was deeply involved in polio vaccination. And in fact, he won a Melina and Bill and Melinda Gates award. This award was supposed to be a personal gain, but he added and multiplied that money into up to 3-4 times and used it to develop other parts of the health sector. I think, and the immunization as part of the primary health care system also was not left out, because the eradication of polio in the environment was a very, very story that told itself. The slide also showing his partnership with the hostels, the schools, and the missionaries. He built student hostels at ENU, office and classroom blocks complex at ENU Hospital, donation of ambulance to the same hospital, building new hostels, and the Congregation of Immaculate Conception, Umoji, built 500-bedded hostel for the midwifery, School of Nursing and Midwifery at Mpo, new classroom at block at Mpo, school gates and perimeter fencing of Mpo, demonstration of block for the midwifery in Mpo also, the new administrative block, donation of ambulances to the school, multi-purpose hall for the library of the school, and donated computers as well. He built a new classroom for the College of Health Technology, Obosi, clinic for the college also, and donated ambulances to them, including that at Adazinuk. These are what I'm showing now, some of the pictorial evidence. The perimeter gates for the school, fencing, the classroom blocks, Northern School of Midwifery in Mpo, and that of St. Joseph Adazinuku. And also he built general outpatient department at St. Joseph Adazinuku, as well as Dr. Wilo, his famous Dr. Wilo Heart Center, which he built at Adazinuku in Anambra State. He always talked about it that he never knew Dr. Wilo, But he told him that this is what he can do. He provided the funding, and the heart center was built, and the activities has been going on there, and people are benefiting from it. They're all verifiable evidence, and all those things are achievements he had in health based on ANID, Anambra Integrated Development System. These are the lists I've just mentioned before. There are many of them. This is a block at Umoji. Bromeo Hospital, also a missionary hospital, St. Charles Bromeo Hospital. This is one of the building, the resident doctors' quarters in that hospital. This is the missionary hospital of Holy Rose of Onitsha, where he built the ultramodern maternity complex and the school of midwifery, that of emergency, and also in a school of midwifery in Hiara. These are the structures he partnered with them and built. This one is a school of medical laboratory sciences because he wants to use it to give as much as possible manpower generation. This is that of Hienu. He equally donated funds to some of these hospitals. At least as we can see, these are the various ambulances he gave and the donation of up to 100 million naira to some of these hospitals for them to start developing the facilities they need. These are the opening of one of the Anglican church at Ogidi, where he donated ambulance. This is a school of community that's in Nuku. Gave them money to start developing the structures to create enabling environment for training. Now, you can see some of the pictorial evidence. These are the list of the donations that he made. Fine. He also accredited the school of the teaching hospital for medical student training, as well as resident doctors training for specialists. He accredited health school of health technology, Obosi, and accredited College of Nursing and Midwifery, Adazinuk, for training. And in fact, I can tell you today, in our hospital, Federal Neuropsychiatric Hospital Enugu, these schools are beneficiaries and they come in droves for their psychiatric posting at Federal Neuropsychiatric Hospital Enugu. So now, what are the gaps? Because if I start talking about what he did, it will be as if I'm singing praises. But I must be very critical about it, about my talk. He, as a person, is not a God, is not God, and can never be perfect. Because I know within his era, there was an issue between him and doctors, and strike issue came up. But good enough, he was able to resolve the issue, at least starting from somewhere based on the economy. And the subsequent government in Anambra State upgraded from where he stopped. In conflict decisions and conflict negotiations, he was very, very pragmatic about that. And good enough, he was able to resolve the conflict between him and the doctors. Now also, just like any other system in Nigeria, he recognized he cannot do much than his budget can carry him. But at least there were some of the primary and secondary healthcare programs that are needed that he was not able to do. Now, but at least he built a standard. I wouldn't want to concentrate more on him at this point. I want to look at it from the national level. There are 3 tiers of government I want everybody to know, especially those that are going into governance. The primary healthcare system, secondary healthcare system, and tertiary healthcare system. One of the things that is evident in Nigeria today is that the gap that has been identified both in Peter Obi's era, which he tried his best to close up, and at other states, is that there appear to be a collapse of these 3 tiers of government, of these 3 tiers of health system, and over concentration of services at the tertiary healthcare system. Tertiary healthcare system is supposed to be training, research, clinical services, and other related issues. But you find out that in Nigeria today, all the teaching hospitals and specialist hospitals appear to be running primary health care services because the population teams into the system to take up the time. And that is why people say that it is a mere consulting clinic. Nigerian hospital is like a mere consulting clinic. I want us to understand it is so because the low manpower that are supposed to take up some of the patients, the middle and specialist manpower that are supposed to take some of the patients at the state level, at general hospital level or cottage hospital level, and the teaching hospital level, we are now being concentrated at secondary, at the at a tertiary healthcare system. And the implication of this is that all health workers, including doctors, pharmacists, pharmacy technicians, assistants, laboratory scientists, laboratory technicians or assistants, nurses, health attendants, environmental health officers, and all people in the health sector, all of them concentrate at the specialist hospital, struggling, quarreling, fighting for who leads and who do not lead. But this wouldn't have been if other health sector are being taken care of. And at this juncture, I want to point it clearly. For us to get health system correct, our healthcare system correct, we must deliberately go back to ensure that these 3 tiers of health system took preeminence. And one of the gloomy pictures, it's not only in Anambra State, is that Nigeria is the 187th out of 191 countries of the world in which that is 180 out of 197. Just check the gap. That is about 6 or 16 or thereabout at the lower level that does not have universal health coverage. And this universal health coverage is bent and is also tied to the issue of general hospitals and the primary healthcare system, and not tertiary healthcare system that is very far distant. There's always low budgeting in the health sector. Like I said, at this point, I wouldn't want to dwell in much in Anambra State, but I want to make it a national issue because it is a national emergency now. Yeah, I was saying there is no adequate and functional health surveillance system. In fact, it will surprise you that when I was trying to gather some of the information I needed, I was not able to gain access to some, for whatever reason. There is a lot of public health challenges in the country today and poor health coverage of national health insurance scheme. There is inaccessibility of quality health care because most of the healthcare system are being at a distance, being built at a distance where the people can access. Even when it's not, the distance is there, the roads are not easily walkable or movable. There are lack of health professionals due to unemployment or underemployment. You are be surprised that today, many resident doctors will pass primaries, but they will not have placements for training. Some of them will be revolving over years. And the only little opportunity they have, they will disappear. There are very poor health budgeting. Now, Nigerian health budget is 4.17% of the total annual budget. And when we translate this in Naira, we are talking about 6,400 Naira per person per year. In a country we pay, and that means we pay out of pocket expenses. Let me elaborate more on this. In a health budgeting, divide it by the amount of money, by the number of Nigerians. Each person is entitled to 6,400 kobo. I mean 6,400 Naira to access healthcare system in Nigerian budget. In a year. So if you divide this by 12, I wonder what you are going to get. That is the situation. And we pay out of pocket. You go to the hospital today where I work, there are many people that are indigent there because they cannot pay their bills. We need to be compassionate enough, and our leader must be held accountable and also show that compassion to our patients. Sometimes the patient will come to the doctor that, I wonder how much we are being paid, to beg for money to purchase the drug that you prescribed in the clinic or under admission. It could be frustrating. Are we talking about citizen health sector disruption? Count it over years. It also impinges on ASU strike in the universities because it affects the training of the doctors. We can imagine the gap we have lost this time around just for the strike, because number of medical professionals that have come out in Nigeria to help, most of them were stagnated because of this. Okay, then there is lack. Everything about this boils down to lack of governmental will, political will. How do we close this gap? Anybody that wants to develop good healthcare system in Nigeria and pay attention to its sustainable development goals must pay attention to this. The first solution to the problem is political will. The leader must be deliberate enough. The second solution to the issue is also political will. The third solution, political will. Then I can classify the remaining as others. I am much more passionate about this because with good political will, we can set the ball rolling from one political dispensation to the next political dispensation, and before a particular period of time, a target of good health care coverage will be achieved. Then what are the others that I see as minor? There must be a deliberate increase in health, education, and agricultural budgeting. That must be deliberate. We spend more on military, we spend more on other areas, but this time around, I challenge any Nigerian leadership, anybody in the authority, to deliberately raise to, if not at least 10% benchmark on health system, and also increase by 10% educational system, and increase by not less than 30% agriculture. By this, all components of SDGs would have fallen in place. Then another thing is to restore the effectiveness of the 3 tiers of government of healthcare system: primary, secondary, and tertiary. And this will improve the so-called universal health coverage and decongest the tertiary health institution, where they will concentrate more on training, some high caliber clinical care, and then research for our people. Primary health care must be made a priority because it ensures universal health coverage. Within this primary healthcare system, it must be decent, well equipped. Services are made available with certified medical professionals and also made accessible, and out-of-pocket expenses eliminated as much as possible. By enlarging the horizon of National Health Insurance Scheme, I have a proposition to make at this point before the end of this discussion. Now, you see, majority of Nigerians are poor, and they live in rural areas where there are little or no social amenities. The implication of this is that they do not have money to care for themselves. But imagine in a situation where there is non-formal health insurance scheme. We have formal sector health insurance scheme and non-formal health insurance scheme, where community associations should be the center of collection of the premium, yearly premium. Let's take, for instance, there's women association or women organization in a village or small cooperative society where people gather, get registered, and get initiated into health insurance scheme. Their benchmark will be raise, even if it is 1,000 naira monthly, making it 12,000 naira per month, per year. Or for primary health care services, or you can go for the secondary health care and the benchmark is being raised. Again, the local government area will provide their counterpart funding into this. The state will provide, and the federal government will provide. And the fund will be domiciled within the HMOs. It makes accessibility of healthcare very easy, that we can walk into the hospital, get treatments, get our medications, and go back. Those in diaspora, those that are living in town, it will make easy for their people, elderly mother, to walk into the hospital around that is decent, purposely built to access healthcare. I did a study, and I've always said the cost of transportation, and it's in line with most of the literature, that the cost of transportation to access medical care is about 60% of the total cost. 60% of total cost of healthcare assessment as out-of-pocket expenses is being spent on transportation alone. Imagine when quality healthcare is given to the people at home, and you ask them to pay into the insurance system the little pantry, the transport money they will use, and they will save the other costs, including laboratory services, consultation, and drugs. That many researchers has done that, and that is the correct what is in the literature. We should go back to how it was in the early days, when housemanship was done at general hospitals. That time I did my housemanship at Murtala Muhammad Specialist Hospital, Kano. It was a general hospital. General Hospital at that time, yes, we upgraded them, but we need to replace them at least at each local government area or close by so that people can access this. And that takes us to issue of manpower remuneration of healthcare workers. Like I said before, there must be a deliberate increase in the health insurance coverage via formal and non-formal health insurance scheme. For non-formal health insurance scheme, cooperative society should be made the operational base. There must be an improvement in the infrastructural base through public and private venture. And they encourage homegrown and home use researches based on local need. My dear colleagues and friends listening to this program today, Nigerian health system and healthcare system is suffering a lot, and the revolution needs to be declared in that side, in that direction, by anybody coming in. I've all tried to x-ray how Mr. Peter Obi of Labour Party has done his own job in Anambra State based on the level of the state and the level of successes he has made. I've also tried to tell him and tell others that there are gaps that need to be filled. And some of those gaps I've profiled that as much as I could gather on how to solve the problem. And I wish Nigerians to be very, very pragmatic in the choice of leadership this period. Because the choice of leadership this time will determine a lot about our future. But what is known clearly to us today is that the problem of Nigerian health system is multifaceted. Only a deliberate, determined, and sustained effort aimed at understanding, planning, implementing, and evaluation can improve it. Good governance is the key. Mr. Peter Obi, take note. Thank you very much.
All right, wonderful presentation. Can we hear me? Dr. Shegu, can you hear me?
Yes, yes, I'm hearing you.
Ima, we can hear you.
Okay, all right. So that's wonderful presentation. Thank you so much, Dr. Vincent Obi, for a wonderful delivery. Due to network challenges, we're only able to stream live to YouTube and to Twitter. Possibly in our subsequent editions, we'll be able to stream to all our social media networks. So at this point, I would like to invite Dr. Shegu to, let's leave the Q&A for now so that people will not leave. Dr. Shegu, please kindly introduce Doctors For Peter Obi, and just use 5 minutes to do that. Then we'll now go ahead and take the questions and answers. But we are going to finish this discussion by 7 p.m. Thank you very much.
Okay, before I introduce Doctors For Peter Obi, I would just like to invite Dr. Dorothy Jeffin Amani, who is a member of the Board of Trustees, to give a short goodwill message. Dr. Dorothy, are you there? Dr. Dorothy, can you hear me?
You need to make a co-host.
Yeah, you need to unmute. Okay, let me unmute you. I know you are talking.
Let me see what I can
do. Okay, unmute, please.
Okay. Hello, everyone, and thank you, Prof, for that wonderful presentation. It takes us back to what our fears and our worries are as medical doctors, especially those of us living in this country, Nigeria. We cannot talk about a better Nigeria without emphasizing on the need for healthcare for all and, of course, well-being for everybody at all ages. That is the Sustainable Development Goal number 3. I will also, at this point, also like to mention that one of the things that we would like Peter Obi to do, as we're anchoring this series on him, is for him to go back to the Abuja Declaration on Health, in which African heads of states came together and agreed on the 15% of national budget to be dedicated on healthcare. Now Nigeria is doing below par, doing almost less than 5%. I know that in 2021, the budget, the health budget was approximately 7% of the national budget. But then we would ask ourselves, what exactly was the national budget, the total national budget? So those are the things that we would like him to look at. Like Prof said, it requires the will to do what is right. The healthcare spending by the government is also very low. We're doing, I think for African countries, we're doing a lot less than the developed world. So this is something that we also look at. And most of the healthcare spending out of pocket expenses, like Prof also mentioned, we would like government to do more in building a healthcare system that is non-discriminatory and very efficient to encourage the best outcomes. For us in Nigeria, another thing is the healthcare, the spending per capita. So while here in African countries, in the less developed world, we're doing 1 digit. Some countries are doing $8 per capita. Some are doing maybe 90 or 80. But in developed world, the spending per capita on health is in thousands. Some countries are registered over 4,000. So these are numbers we need to remind ourselves every day as medical practitioners. And we're hoping that with Peter Obi, having seen what Prof has mentioned, he has done in Anambra State, and those are verifiable, like he said. Somebody who has done much with the little. I believe that if he has the authority to do more, he can. So being also that we are pinched, we are the worst pinched when the economy plunges in this country, whether it's in skill, whether it's in pharmaceutical, whether it's in daily hospital visits or tertiary or secondary institutions. We are the core of it, because nothing happens without healthcare. Without health, we have nothing. So, Prof, I want to thank you so much, and also thank my fellow colleagues for being here. I hope that in the days to come and other very interesting topics that we have mapped out for this series, everyone will put in their best, spread the knowledge, spread the knowledge about the events, and let's see how we can harness ourselves, be positioned enough to have one voice. I think this is the time for everybody to say something. They say, see something, say something. We cannot afford to be quiet. We cannot afford to sit on the sidelines. No one in Nigeria, as a matter of fact, can afford to sit on the sidelines. So thank you, everyone. And we hope that we grow in strength more and more. So thank you. Thank you, Prof.
Thank you very much. Yeah.
Okay, just do a short, Prof should have been this clear now all this while.
He's clear, I can see him.
Yeah. All right, so by way of introduction, I've said a few things about Doctors For Peter Obi, but I will just reinforce what I said. It was convened on June 11, 2022, and it was convened based on the realization that for the first time in a long time, there appears to be a candidate that is really committed to developing Nigeria. A candidate that is not that does not have a personal agenda or a tribal agenda or a sectional agenda, that has what appears to be a Nigerian agenda, and who we can line up behind and know that with that credibility, there is hope for a transformation in the country. It started like a joke. It was a first WhatsApp group, came filled within 24 hours, a second one, and then we exploded to all the states and to the USA and the UK, and now it's 7,613 doctors. Our mantra in the beginning was, we call it the ABC of being an obedient doctor. A means activating your PVC. B may be aggressive in getting colleagues to get on the platform, and C means coordinating medical outreaches. We did about 36 get your PVC outreach in like 22 states. We saw over 50,000 people where we were doing outreach and we're telling them to get their PVC. We did that in conjunction with Doctors For Peter Obi then. We went further to do is 16 states, 16 local government, all state outreach in Taraba State, and so over 5,000 beneficiaries. Our next step on the outreach now is to do an outreach in every local government. Just what we did in Taraba State, we are planning to take it nationwide. And eventually our ambition, if there is time, is to do an outreach in every ward. We are partnering with Peter Obi Support Network that has an Adopt Your Ward program. We are trying to hinge our outreach in every ward to it, so that as you are adopting your ward, part of what we are doing for you is a medical outreach. We have a strategy meeting to conclude with them tomorrow. The Health for New Nigeria is also an initiative of the Doctors For Peter Obi. We have 11 topics, I think, ranging from, I think the next one is about brain drain. We have health finance, we have intersectoral rivalry, we have health research, we have practically everything that is needed to transform the healthcare system in Nigeria. And we will continue to bring seasoned technocrats to provide solutions to what is going on. As I said, our mantra in Doctors For Peter Obi is collective intelligence. We want to get more out of everybody's brain that has ever been. And these sessions are going to be recorded. We hope at some point that His Excellency will join us on one of the sessions himself. But before then, we are recording these sessions. Dr. Okupe inaugurates us, and I speak with him almost every other day. I have told him about this series, and he said as soon as we are done, I should send him the content. He will forward it to His Excellency. So whatever message we put together, whatever strategy, whatever insights, whatever intelligence we are able to provide, I can assure everybody that it is getting within 24 hours max, it is getting to His Excellency. So we can focus on it and be very stringent in what we deliver. A few of some of the programs we also have coming in the next 48 hours. We'll be launching the Save the Brain initiative, where our neurosurgery group, the Doctors For Peter Obi, has a specialty services group where we gather super specialists from neurosurgeons to cardiothoracic surgeons to dental to ophthalmologists, about 10 different subspecialties. And we are starting with a neurosurgery program where we will get indigent patients with potential neuropathology that are amenable to surgery. And we'll be doing these procedures free. So that should be launched in the next couple of days. We're enjoying everybody to support the Doctors For Peter Obi. We've spent through our internal personal funds over 13 million. We will be coming for fundraising soon. I think Dr. Dorothy is chairing that movement. We expect everybody to get on board. Our philosophy is, for the first time, if we can support a candidate that is not spending any shishi, that is not giving us shishi, if he gets there, he's not going to have a choice other than to do what needs to be done, because he owes no allegiance to anybody. He owes allegiance to all of us. So for the first time, we'll have something that really belongs to everybody and belongs to nobody, because we all contribute in taking him there. For those who want to contact us, just go to our website, docsforpeterobi.com, or our Twitter handle at docsforpeterobi. I'll post all that in the chat room shortly. If you're a doctor in any, in Nigeria and in diaspora, the movement is for you. If you're a non-doctor, then you can support us by every other means possible. Thank you, everybody, for joining us. I think we can take the Q&A. Before then, is Mickey here from Like Minds for Nigeria, one of our partners? I'd like him to make a few words. Mickey, are you here? If you're here, can you raise your hand? Okay, I'm not sure. So Chima, over to you.
All right, thank you so much, Dr. Shegu, for that brief remark on Doctors For Peter Obi. So we're going to take questions. We are targeting and finishing by 7 p.m. This is a 2-hour series. So please be checking our website for details on subsequent topics. All right, so I would like to unmute Philemon Okoro. Please, you have 1 minute or about to ask your question. So Philemon, I will unmute you now. So please ask your question very fast or make your comment.
Okay, thank you very much. Good evening, everybody. This is Professor Philemon Okoro. First, I want to thank the presenter this evening who did a very nice work on what Peter Obi had done in Anambra. And I also want to thank the group of Doctors for Peter Obi for what you're doing. It's quite commendable, and I must say that we are really making a whole lot of progress. But I just want to point out, I don't know if there are other things that have been done before now, but I think one of the major concerns, which I think we as doctors should recognize, that if we care for the health of our people, this effort is part of our responsibility to ensure that our people are healthy. And so we should take it as part of the oath we took as doctors. If we have a better society, definitely the individual citizens will be healthier. And so we shouldn't see it as a cause for P2B, but as a cause for the people we took oath to take care of. Having said that, just very quickly, everybody has continued to talk about the problem of structure all the time. I don't know what Doctors for P2B are helping or doing in that direction. I personally would want to contribute in my own way, but I think that we need to begin to think what we have just done is really academic. The truth is, most of us that are here are already convinced about P2B. And telling me about what he has done in Anambra is excellent, but I think I have had enough to make up my mind. What I thought we should be putting a lot more effort in now is to find how we get around making sure that that thing they said there's no structure will not be true. Some of us, anybody who has the capacity to get into INEC either as a polling agent or whatever, should make effort to get in those places so that when they start their gimmicks, there will be people within the INEC itself that will stand up and say, no, this is not what we said it should be. And then we work from inside. I don't know if Doctors for P2B are having any plans in that direction, but I think this is the time we should begin to put a lot of efforts to get ourselves into the structure of INEC, into the structure of everything that we need, even the police, the military. There are people who are obedient in those places. And we must be able to latch on those people's enthusiasm to get the structure. Otherwise, we may talk all that we said here excellent, but it is us who are already converted that are listening to it. And I think the organizer should begin to think more about it. I personally am willing, and I think I should be able to say something or do something. For I have a polling booth where I live. I've been asking, what is the plan? What can we do to ensure that that vote that we will drop there will eventually get to the final point where it will be counted? Thank you very much, all of you, for all the efforts that are being made. We will definitely get there, but we need to begin to work with purpose, focus, particularly on the issue of structure. Thank you very much.
Thank you very much, Dr. Philemon. I would like you to know that this Health for a New Nigeria series is actually for when Peter Obi becomes president. But before then, we also have other interventions that we are doing for him to become president. So it's a multi-pronged approach. We cannot, be doing only things for him to become president. They are very important. But when he becomes president, he needs to have some of the things that he should hit the ground running as far as the health sector is concerned. Peter Obi is being supported by several support groups. The last time I checked, there are more than 600. Our own group is peculiar. We are doctors. We have expertise in the health field. But what we are trying to do is to see how we can support him to win the presidency come 2023 February by the activities that we are doing, by the advocacy that we are doing, by a lot of things that we are doing for his campaign efforts. But at the same time, we're also looking forward
President, how
to govern. So I appreciate, we appreciate some of the things that you have said. They are well in line, and we'll take note. Kindly send your details to Dr. Shegu or myself so that we can follow up this discussion after now. All right, so we have other people that want to ask questions. We have just about 15 minutes remaining. So I'll give the Reverend Dr. Charles Okereke 1 minute, and then I'll give Abo 1 minute. So Reverend Dr. Charles Okereke, please unmute yourself.
Yeah, I greet everyone. I thank you for the effort so far. I want to appreciate. I just heard you say you work with you collaborate with the Peter Obi Support Network. That's a good one. That's a good one. Right here, I'm in Nigeria here now. I just came over from South Africa, and we have asked for the local government. My own local government to be handed over to me, because this is a serious business we're doing here, and it is happening already. We'll be glad with the doctors in the local government, some of the programs. So we'll keep in touch, updated, planning our programs in that local government here in Anambra State. So in Anambra State here, so that we can actually, I support what the professor just said now. We have to make sure that our programs get to the grassroots. And the first thing is for Peter Obi to come in as president. That's one thing we must try and do. And the rest, Peter Obi is obedient himself. Is obedient. So I think that's what I want to contribute. Thank you all.
All right, thank you, Reverend, for that contribution. Kindly send your details to either myself or to Dr. Shegu so that we can follow up the discussion. We are not only partnering with P2B Support Network, we are partnering with other support networks like mine, and in different states, we also reach out to other support groups. So the idea is collaboration is in partnerships, is in synergy, so that we don't duplicate efforts and then we achieve maximum results. Have another person raising hand. Abu, please unmute yourself and speak. You have 1 minute. Abu, please unmute yourself. Okay, so it seems as if Abu does not want to say anything. All right, we still have 11 minutes remaining in this session. So if anyone wants to make any contribution, please go ahead and make a contribution. Hopefully, the next series that we're going to do, we will try and make the Q&A session to be more interactive. We are going to be having a talk on brain drain, reversing brain drain to brain gain, and then the role of the diaspora in health for a new Nigeria. So it's going to be a very interesting session. You know, like Dr. Chegu mentioned, Doctors For Peter Obi exists in the 33 states of Nigeria and in the FCC. We also in the diaspora, USA, Canada, UK. Our UK is one of our most vibrant branches, you know. So they were the one that sponsored the Taraba State medical outreach in August across the whole of Taraba State, and it was very, very impactful. In fact, because of the outreach, a lot of people came to know His Excellency Peter Obi, and they are favorably disposed to voting for him. All right, so going to be a discussion. Then we also have other topics. We even have nursing care for a new Nigeria, pharmacy, and all that for a new Nigeria. So we are trying to bring all the components and all the key players of the health sector so that we can
Abu is back now.
Okay, Abu is back. Okay, Abu, please unmute yourself and speak. You have 1 minute.
Hello, thank you very much for this forum. Incidentally, I just joined some few minutes ago, and I'm so happy that you had organized this forum. I am calling you from Obudu in Cross River State. I've looked at the list of the people who are attending. There's not much from my own access. And I also want us to look at the possibility of looking at areas where there is need to help in terms of material and whatever. Because there are areas that there are a lot of the Peter Obi support group has already penetrated very much. There are some areas that there is need for help, and that should also be taken care of in terms of logistics and how it's going to work out. I am a past local government chairman. We know what happened on election day. We need to actually be sure that it is not just in this forum, but how to get the votes in on that day and to make them count very much. I'm really very happy for what you've done. Thank you very much. Thank you.
All right, Abu, please, after this session has ended, you can go to our Twitter platform at Doctors For Peter Obi. You will see the full recording of this presentation, and we have noted your comments. Please send us your details, phone number, email on the chat box, either myself or Dr. Shegu, so that we can reach out to you. All right, Dr. Shegu, we have Itoha Oako who wants to make a comment or ask a question. Please, our presenter is still here. He's waiting for clarifications. So I'm going to allow Itoha to make some remarks or ask some questions. Please have the mic. Itoha Oako.
Okay, yeah, thank you very much. Good evening, everyone.
Good evening. I can hear you. Go ahead.
Unmute yourself, please.
Yes, I did that and somehow I got muted again. Sorry about that. Good evening, everyone. Glad to be here, though I'm very late. I actually got to see the notice just a couple of minutes, like 10 minutes ago. I know I would get the recording. Hopefully, I should be able to, go back and listen to what was discussed. But I have a question. It's kind of been on my mind for a while, and it has to do with Peter Obi. I don't know if this is a political platform, if it's something I could ask here, but I believe since we are doctors, we would know better and probably prefer an answer to this burning issue. And what's that? Really, I'm for Peter Obi. I really believe in him. I've heard and seen some of the things he's done. But one thing that is kind of against him, and one thing that is being thrown at me most times when I try to speak for him, is the fact that they keep saying during his tenure there was a 13 months doctor strike and all of that. And and though for my own response before now had always been, it takes two to tango. It takes both the government as well as the aggrieved party to tango for any strike to be prolonged or shortened. But really, I don't know. Is it something that maybe more light can be thrown? Is it something I can ask here? It's just for me to get answers, basically, because I would really want to understand how a governor in his time, really allowed a strike to last that long for 13 months. Like I said, this is just me seeking answers. Thank you.
Okay, before I ask our presenters to answer the question, I will put something on the chat box so that after now you can go and check it out. An expose was done on this issue on Twitter by someone that was very close to His Excellency when he was in power. So I'm a leader in the fact I just handed over as the national first vice president of NARD as NAD. All right. I have led a strike when I was center president in Enugu. There are lots of issues that that may not be public, as far as strike actions are concerned. So we may not look at it in a simplistic manner. You understand? But we need to check some of the things that we are playing out in the background. It's not just as simple as these people were on strike for this number of time and the government is not doing anything. If you dig deeper, you get to understand some of the idiosyncrasies and some of the issues that, as a governor, you may act in a similar pattern. All right, so I would like to invite Dr. Vincent Obi to throw some light while I put the Twitter handle for us to do further digging, after now. Dr. Obi, please take your comment.
All right. Thank you very much, Mr. Edoga, Dr. Edoga, and all the people that have spoken. I can see Philemon, my old friend. I'm very happy meeting Philemon here today. In fact, the issue of strike is a complex issue. For some of us that have been in the leadership of some of these national, like National Association of Resident Doctors, or ARD instead, because I was one time a president of ARD of our hospital, Federal Psychiatric Hospital, Enugu. The issue of strike, sometimes talking about it is more or less a complex matter. Because in our fights as individuals, we always believe that if you climb the hill, if you climb an Iroko tree, you collect all you need to collect from there because you may not be able to climb there again. In Anambra State, what happened there is similar to what happened in other states. When the federal government raised the benchmark salary for the federal establishments and also made it open for other states to negotiate with their team. And what I know very well that time, what I still remember from my interactions with during my research with some of the stakeholders that time was that there was an offer of certain amount of money or percentage of certain amount of money, and the other people refused. And he who wears the shoe knows where it pains. And at the end of the day, what is important to me is that that strike was resolved, and the progress from the strike and subsequent demands updated in subsequent governments. The management of strike is complex. I will not say Peter Obi is innocent, or the ARD people are innocent, or the Minister of Health are innocent. The most important thing here is that in every problem, there must be a solution. And at the end of the day, solution was achieved. That, to me, that's what is important. And there are many other things I found out during the research that I would not want to say publicly here because some people are involved. Governance, why we are struggling to make sure that there's an accountable and a good governance system comes into play is because of some of the challenges we made. I will tell you something here. Why did Peter Obi decide to upgrade some of the general hospitals at rural areas, to upgrade some of the missionary hospitals? Why did he go direct to those people for direct interactions? Giving them money, telling them that this is what they want, they provide what they want, he makes sure that what they want is needed. Why did he, in building cardiac center, call Dr. Milo to bring out his budget on what it takes to implement that? And he brought it out and he funded it, some of them directly, getting the people that funded it direct and other things. Government is a complex phenomenon. It is not the president alone that is in the government. Those that are around him could equally be some obstacles. And I trust doctors that when we need something that to help us perform better, we have to stand our ground to get it. But when we are sharing the blame of these things, we may not blame Peter Obi alone. But one thing remains that he finally negotiated through. That is my position on this. There's a lot of things to see if we start talking deep and deep and deep on this. But advise your friends that is that, yes, that is the case. But the same doctors also are rallying around him now. Why? It's a paradox, isn't it? So, why doctors are rallying around him is based on to doctors, you fight, and you can become friends after the fights. I think most of the doctors that fought with him that time are equally obedient, even now as we are talking. So it's part of process, and that process has come and gone. Let's take the results and the resultant effect out of it, and then prevent such from happening as we are just presenting today. But one thing is very clear: it will be invested in a lot of issues on health sector. But I know the head within this Doctors for Good Governance, we can guide him better if he finally wins as Nigerian president, based on this information we are bringing up now. Thank you very much. I don't know whether I answered your question. Attempted it, so to speak.
All right, thank you so much for that. I think we have come to 7:02. Okay, thank you very much, everyone, for coming online. If you have any more questions, please feel free to send us direct messages. Like I said, Twitter handle is at docs 4 at figure 4, then Peter Obi combined. Okay. You can also check us out on our Telegram platform, which can host up to 200,000 people. You can also check my handle at Edoga, Dr. Edoga MD, Edoga MD. So we are going to be having this series every Tuesday by 5 p.m. So it will be very, very wonderful if you can join at least our Twitter and our Telegram platform so that you can get in all the information as far as this Health for a New Nigeria series is concerned. Then we're also looking for more doctors who will become obedient that will help us in actualizing our objectives to do medical outreach across all the over 770 local government areas of Nigeria. We have so far done in Taraba, and we intend to do in all the local governments. So Shegu, please briefly make your closing remarks so that we can bring this into a close.
Thank you, everybody. It's been wonderful. Prof has done a fantastic job on the subject matter as both a doctor and a diplomat. So thank you very much, Prof. It's been very inspiring meeting you. Thank you, everybody, for staying up. The battle is still on, and I'm sure victory is certain. So thank you. See you guys next week.
Thank you very much, and goodbye.